My new report, Oversight, is about the Ministry of Health and a network of services called the High and Complex Framework. These services are for people with an intellectual disability who are in secure or supervised hospital or community care. The Ministry of Health is the kaitiaki of the New Zealand health system. It is responsible for making sure the framework can support the people it's intended to support. Some people who need framework services have come into care through the criminal justice system. Others have not been charged with any criminal offending but need a high level of care. They need specialised services that support them with rehabilitation to live good, balanced lives with as much independence as possible. Ideally, the framework will support people to be able to move from hospital to community care. My investigation found that the framework services were not always achieving these things. Problems had built up over some years, especially problems of capacity. There weren't enough hospital beds available under the framework for people who needed them. This meant people needing framework services were not always able to be placed in suitable accommodation. Sometimes people with an intellectual disability spent longer in prison as they waited for a hospital placement. I found that the Ministry of Health didn't do what was needed to make sure framework services were able to provide the necessary support. Even though the ministry knew about the problems with the framework, it didn't do enough to plan, monitor, act, or develop ways to prevent these problems getting bigger. Overall, I found the ministry acted unreasonably and failed to meet its stewardship obligations. I've made substantial recommendations for immediate action, and the ministry has already taken positive steps. I will receive my first formal report back in September.